Winterthur, 30 miles from Zurich in northern Switzerland, is a service and high-tech industry centre. Perhaps that's why the 100,000 plus inhabitants openly embrace innovation, especially when it's seen to be an overwhelming success. None more so than specialist Dr Christian Busch. His recent paper into the treatment of chronic ulcers is convincing even CellSonic skeptics.
Many times people tell us it sounds too good to be true. And I have to admit, in the beginning, I didn't believe it either. I had to see it, and I had to see it over and over again to believe it. And now, using the machine every day, I know it is good and I know it is true.
Dr Busch is so convinced about the effectiveness and safety of CellSonic that he's using it to help heal his daughter's non-diabetic wound.
The major benefit is that we really do increase time of wound healing. Even wounds that didn't heal before, they start to heal. Even sleeping wounds or dormant wounds, they will start healing. So we shorten the suffering time for patients, and we dramatically lower the cost of treatment.
But back to diabetic ulcers and the success rate of Dr Busch at his Swiss clinic. He's successfully treated more than 200 wounds. Today, 180 of them are closed.
In my eyes, the CellSonic machine at the moment is the only means that really avoids amputations in people with patients with diabetic wounds, yes.
There's no doubt in Dr Busch's mind that if CellSonic was in widespread use, amputations would be avoided, beds would be freed, and money would be saved.
The effect that we know that we have a device that really helps treating wounds is not available to the broad population. To me, it's very surprising and sad at the same time, because I know that we can help people, but they don't know it. So it's not available, unfortunately.
But Dr Busch hasn't always been a convert. He too was skeptical about success. Were claims of the healing potential exaggerated? Was CellSonic nothing more than a gimmick?
I got convinced by the CellSonic machine just by the very fact by using it. In the beginning, I was approached by the company and they asked us whether we were interested in testing it for treating chronic wounds or ulcers. And I said yes. I was working at the University Hospital, taking care of wound patients every day. That was my job at that time. And so we were able to receive one of these machines. We started treating patients in daily practice with wounds that wouldn't heal for a year, 2 years, 5 years, 20 years. So really very difficultly treating wounds. And we started to treat the first few patients. They came back a few weeks later for a second treatment and all the wounds had improved. And this was very amazing for us because we didn't really expect it.
But healing hasn't only been achieved with diabetic ulcers.
In addition to treating chronic wounds that have been around for years or months, we started using the CellSonic machine in our daily practice on any type of wound that is showing up. So patients with post-operation wounds, or sometimes we have some scarring problems, or sometimes the wounds are a little bit wet and we need to speed up the process. So on any kind of skin condition that is not really healing well, even within a week or two, we routinely started using it, and we see a big benefit for all these kind of wounds.
But how does it work? And why does it work?
What happens when we use the CellSonic machine on chronic wounds? We know from measuring blood circulation that instantly after treating wounds, we have an increase of blood circulation. So blood supply is being improved, which is important as oxygen is delivered, which is important for wound healing. But this is only one very quick effect. On a cellular level, we know that the fibroblasts, meaning connective tissue cells below that need to close really the lack of tissue, they start to proliferate. That means the cells divide and become more and more. So the wound is closed from the depth. And the keratinocytes, the human skin cells covering the wound, they will start to migrate. So we switch on proliferation, cell division, and cell migration. And this finally closes the wound. Amazingly, we don't see any side effects of the CellSonic treatment. In some patients that already have wounds that are very painful by themselves, of course it can hurt a little bit, but most patients, the large majority, they don't feel anything at all. So we do the treatment and I ask them if everything's okay. They say, of course, yes, they smile at me during the treatment. So there are no side effects at all.